Ever wonder what motivates people to get plastic surgery?
Did they regret it?
What can we learn from the weird and wild stuff that happens at our plastic surgery clinic? We're going to tell some stories, get some laughs, and learn on
Clinic Talk with Sabrina Sajan
on the Plastic Surgeon Podcast.
Hello, my friends. I'm Dr. Javad Sajan, and of course, I'm here with my lovely wife and CEO of Allure Esthetic, Sabrina Sajan.
Welcome back, and thanks for listening. Please rate and review us on Apple Podcasts to support the channel. On Clinic Talk, we tell real stories of fun, strange, hopeful, and educational things that happen at our clinics from day to day.
We get a lot of weird and hilarious things happening at the clinic.
You can find the clinic at allureesthetic.com for more information. So, Janu, what clinic stories are we talking about today?
We had a wild week, didn't we, coming back from the holidays?
Yes.
So a lot of things, come back after the holidays, like people.
We hope you guys had a great Thanksgiving.
Yeah, I hope it was amazing. I heard the Fucci friend returned.
Yes, the Fucci returns.
So what happened?
So I think we've talked about this individual a few clinic talks ago. It's this individual that came in to use her coupons for her Botox.
And she was the one wearing the fake Gucci mask and screaming coupon in the lobby, right?
Yes, exactly. So we dealt with all of that, and now we're here.
And she was the one, we gave her free product just to get her to leave. She wouldn't leave.
Yes.
Okay, I remember now, yeah.
Yeah, she wanted to use her Botox coupon, and she wasn't a good candidate for one of the procedures that she wanted, or, treatment that she wanted to do. So in order to compensate for her time for just coming and just nicely leaving, we gave her free product.
And I heard that she made a comeback this week, right?
Yes.
What happened? And
So-
I thought we had her number blocked though.
Yes. So unfortunately, because she, called all of our staff, bad names, and
She used the B word, I heard.
yes, B word and all sorts of other words, and yelled and screamed on the phone and all of the stuff. So we ended up, telling her that we're going to block her number, and we appreciate her not to call this office anymore, and that we're just not a good fit for each other.
So when you guys told her the first time you're going to block her number, what did she say?
She didn't think that we were going to, and then I guess we ended up doing it because she kept calling and was demanding to schedule an appointment. So now, come whatever, a few months later, on Monday this starts, and we get this call, and from another number, and we answer the phone, and we ask for their phone number to kind of pull up their account in our system, and we pull her up, and it's her. And of course, we have tags and stuff in our system where we can, we flag people to just make sure that we're carefully, speaking to them, and we want to make sure that we're setting the right, expectations.
So she got on the blacklist, right?
Yeah.
What's that? What do you guys call that?
Do not schedule list.
The DNS list.
Yes, the DNS list. And so she calls, and here she is demanding to get on the schedule for filler. And we're, of course, we tell her, unfortunately, due to previous interactions with our office and with our office staff, unfortunately, we're not able to schedule you at this time. And she's like, "What do you mean by that? What do you mean? Who said that? Who over there is saying that about me?" And they went on and said the same thing to her, and then she hung up the phone. Then an hour later, she calls from another number and says a different name, and we're like, "Okay, this sounds exactly like who just called an hour ago. It's a different phone number." She says she's someone else now, which we pulled up in our system, and that number is also on the DNS list.
Yes. Now, we can't say her name, but I heard it sounded like literally Mini-Me.
Yes.
She gave a name that sounded very similar to Mini-Me.
Yes.
Like Austin Powers, Dr. Evil.
Yeah. And we pulled that number up, and it's also that one's flagged in our systems. So we're same thing again.
So wait, is she Mini-Me or is Mini-Me somebody else?
Well, this person says that's her friend, and she's trying to schedule this appointment for her friend. And her friend's name is Mini-Me.
That's not the real name, guys, but it sounded like that, so we're using a pseudonym.
Yes. And she said this is her friend that she's trying to schedule an appointment with. And she said she's going to be coming with her friend because her friend doesn't speak English. And we're like, unfortunately, because of COVID restrictions, we're unable to have any guests at this time. We're happy to, have your friend on, the phone or FaceTime to translate. But just because of COVID restrictions, we just can't have additional people.
This is the only time COVID has actually helped us.
Yeah.
Oh my God.
We used it to our advantage in this situation.
Yeah.
So she doesn't take that for an answer. She goes on and on and on. And eventually, the staff member's like, unfortunately, I can't help you any further. And we just can't help you any further. Hangs up the phone. Next day comes and I'm in the office on this day. And she calls again, same number. And then we're like, okay, now we got to call a different number. So now we try to block that number, and then anonymous calls start after that.
Like star 67 blocked ID.
Correct. So block numbers start. And she's calling again from a block number and gives her, phone number and says, I need to schedule an appointment for a Botox and filler. And we're like, unfortunately, we're not able to assist you at this time because previous interactions with her, we're just unable to meet your expectations. And, I think that's fair. We really strive, and we say this to all of our patients and clients here, we really strive to provide excellent customer service. And if we feel that we're unable to do that for someone, we're just not a good fit.
Exactly.
And I think that's very fair,
Exactly. Just like when you get your hair done, sometimes that stylist can't do anything to make you happy. You got to go somewhere else.
Exactly. So, if a practice or a surgeon or a provider is telling you that they're not a good fit for you and we're just not a good fit for each other, I think the best thing is just to take that as a positive and to find someone else. And I think that's fair.
So what did she say when you guys told her this?
So she just would not take that as an answer. Like, she kept repeating over and over again that we must, and she's threatening on the phone, that we must schedule the filler appointment and the Botox appointment for her. She's like, what do you mean by no? Why can't you do it? You need to just do it right now. And she's using all these words again.
How does she threaten us?
She's saying that she's going to actually just show up and we're going to have to do her Botox for her.
Oh, that's crazy.
She said, if you don't schedule, I'm just coming there. So we talked to her and then hung up the phone. Of course, she calls back literally 10 minutes later, again with the block call. And we say the same thing again. And then finally, because the calls were getting extreme and she was getting very aggressive over the phone and threatening us and saying all these bad words and things that we don't want to hear, we eventually ended up telling her that if she calls the office again, either from a block number, from any other number, we're going to call the police.
The police?
Yes. We said, this is the last call. We do not appreciate you calling us from block numbers. We do not appreciate you keep calling and threatening our office staff. And if you continue to do this, we are reporting you to the police.
And I heard you guys made a change in the phone system too, right?
Yes, we blocked all blocked calls.
So we had to make a complete system change because of her.
Yes. So we had to completely block any callers that are calling from block numbers.
So now no one can call our office from block numbers.
Correct.
That's wild.
Yes.
And she's been quiet since then.
Yes, she probably couldn't call us anymore because we blocked the calls and we blocked.
If there were payphones, she would call us from payphones.
Probably.
That's unbelievable. That's
unbelievable.
So that's so wild, but her not being able to come is one of the COVID restrictions we have to work with now, isn't it?
Yes. So unfortunately, because of COVID restrictions, we're unable to do many things that we were able to allow before.
I know.
So,
and one of those restrictions is, unfortunately, we can't allow children in the office, and we can't allow, for appointments unless it's medically necessary. Right now, we can't allow a second person to come with them.
Yeah, like a guest or caregiver friend type of person.
Yeah, we are accommodating. We'll FaceTime somebody in. We'll Skype them in. We'll do everything we can. But we're required by the governor's requirements to limit people coming in.
Yeah, and it's sad, but I mean, it's kind of hard, for us. Like, we want to have, we weren't allowed that. We were allowing that before, of course, because of COVID. We're unable to do it now. But unfortunately, we have to follow the rules and the law. It's, the facilities licenses on the line. There's providers here whose licenses are on the line. We just can't take these risks. We have surgery patients that are coming in. We want to make sure we are protecting all of these people. We just can't have additional people. And a lot of times patients don't understand that. And I'm sure you kind of, went through that when people are coming for consultations and they're demanding for to bring a friend with them or whoever else with them to their appointments, to their consult appointments or whatever. And it's really difficult. It's something that's not in our control.
Exactly. And I have to say, I hate the restrictions. I don't like them. I don't want them. You don't want them.
Mm-mm.
But the hard part is we're forced to do them to stay open.
Correct.
So,
And I understand also that a lot of times like patients, in the past were able to bring in, for example, kids to their appointments, right? To their Botox appointment or filler appointment, they brought their, 5-year-old or 3-year-old or whatever it is. But at this time, we're just unable to. And, I understand it's hard to find childcare and, patients have given us these reasons that, I don't have a babysitter for my child. My nanny just, is not there anymore, or I can't afford a nanny. What do I do? Like, I can't. Unfortunately, that's not in our control. It's really hard. I mean, I feel bad saying we're unable to treat you because we're unable to take you back with another person.
Exactly. And the hard part is, the restrictions are one thing, but unfortunately, we all have, not unfortunately, I say we all have to do our part to mitigate disease. And, we understand how this disease spreads. We understand the science, and we have to, unfortunately, minimize contact where we can safely.
Yes, we really do. And, we're doing, our part in doing all that. And we really appreciate all the people that understand these things. And really, we have to follow the law and the rules. And, it's just would all just be helpful if everyone would just cooperate and just follow the rules.
Now, we've been able to make some accommodation, right? Like, so, we had to stop our warm beverage service, but now we got new service, right?
Yes.
So what's our new, and we stopped making cookies too because of COVID.
Yeah. So instead of, open and hot beverages, we have, closed packed beverages that people can grab from the fridge in the lobby. And then instead of the hot baked cookies that we used to do, we're giving wrapped Ferrero Rocher chocolates upon entry. So just, everyone's adapting to the changes and we all have to do our part. And, there's some things that we won't like and some things, that we will like, so we have to kind of just work with each other to make it all work.
Yeah. And I'm trying to get frappuccinos we can give out so people get coffee still somehow.
Yeah.
So, Sabrina and I, we live and breathe our patients, care and our practice. So sometimes we have nightmares. So last week, we had a really bad nightmare, Sabrina, wasn't it? Yeah. That was your nightmare.
Yes.
So tell me, what was that about again?
Yeah. So this is, I think a couple of weeks ago, and I just like got up in the middle of the night. I think it was like 3, 4 a.m. or something.
Yeah. Yeah.
And I'm like, oh my God. And you were like, what happened? And I'm like, I literally had a nightmare that I walked into the office at 7:30, whatever time we get here, at 7:30 in the morning, and the entire lobby was full of people, like jam-packed people, and there was little toddlers everywhere on the floor, laying on the floor. They had drinks everywhere, cookies everywhere. No one had masks on. And I go in there and I yell one of our front desk staff's name. I'm like, what is going on here? And I literally yelled. And that's when I woke up. Like that's how much this haunts me.
I know. And, it haunts us obviously for safety, but there's something called the COVID police in this state. I'm not going to name the inspector's name. We know them. They're nice people. We respect them. But they're coming around. They're checking clinics and all open businesses to make sure you're being compliant. And Sabrina had this nightmare right when one of our friends just got inspected by the police.
Yeah. So one of our practice friends, another practice who's, good friends with us, they had a COVID inspection to make sure they're following all the COVID precautions and they're following all the social distancing and all of that. And right after that, I had this nightmare because I was so worried, to make sure it's difficult. You have to make sure you have a certain amount of people in the lobby and, rooming, patients accurately and not too many people are waiting in the lobby. I mean, there's a lot of, lot that we have to do to protect everyone. And it's, it can get overwhelming.
Yeah. With that, we're a small business, guys. We're not some Fortune 500 hospital here running around. And with COVID, obviously, everything is less, we're not doing the same we used to do. We're grateful we can be open and we're doing something. We thank God for that. But you have to implement these restrictions while bringing in a lot less revenue to support our employees and ourselves. So it's a real challenge, but we're thankful we're all healthy so far and we're safe. And we're going to keep chugging along and, enforcing all these rules that nobody likes because we have to.
Yes, for sure.
So guys, as our company has been slowly getting more staff and growing, we interview a lot.
Yes.
So I gotta share the story what happened this past Tuesday.
Yeah.
So I know when we started the company, it was approximately 4 years ago, and we started a new program for accepting. I gotta be careful. I can't give too much away. But we basically started a new program in the practice for gender affirming care or transgender care. So we had just started this program to deliver the care. And I had one person who was the designee who ran the program. And she was the only one who knew anything about pronouns, how to schedule, what to do about the billing for because we accept insurance for gender affirming care. She did all of that. Remember that? And so she worked for me. And then she worked for about 9 months. She built the whole program. And then one day she disappeared. Doesn't show up for work.
Wow.
I texted her. We called her. I only had 4 or 5 employees. There was all this outstanding billing, like tens of thousands of dollars. And we didn't know where she left anything because she was the only person doing it. So she disappears. We think she's dead. We got no message for 3 days. And then on the 3rd day, because we were going to file like a missing person report with the police, we get a text saying, I'm having family issues. I'll be there tomorrow. And she kept doing this tomorrow, next week, 3 weeks, 3 months, never showed up, ever. And because of this, we lost a lot of money. There were bills we couldn't follow up on. We didn't know where she left off. She was the only person running it. Appointments were not properly scheduled. We didn't know what patients had paid, what they hadn't paid. This was 4 years ago when we just did a team of 5 people. So it was very different than what we are now. So basically, she goes on her way. We got a replacement. We lost some money, but we got everything cleaned up and we kept moving forward. And the patients got great care. Obviously, we didn't pause the care because of the billing and the other insurance issues, but we kept moving forward. So, we were hiring another person for this role. And
3 years later.
Yes. Now we
fast forward.
Yeah, fast forward 3 years, and we put the job posting again for this coordinator person, not giving the title away. And this person applies.
Yes.
She applies 3 times to this job after she literally, I felt, screwed me over big time. She applied 3 times. I said, no interviews. I'm not interviewing her. 4th time she applied, put a long letter about how she wanted to meet with me. I said, okay, fine. I had our scheduling person schedule the interview for me. It was this week, Tuesday. So this person comes in and they seat her down in my office, and I finish my surgeries and I go in there and I sit down. She starts bawling, crying. And she is a grown woman, crying, mask wet. And I'm like, I'm not going to say her name. Nice person. I'll use that word. Nice person. What's going on? She's like, my life has been hell since I screwed you over. I'm like, what do you mean? She's like, everything that could have gone wrong has gone wrong. My one child became homeless. My other child ended up losing their relationship. I had never lost a job. I've lost 3 jobs. Financially, I made some really bad decisions and I'm in peril. I came here because I know karma got me. And I just looked at her. I was like, wow. And in the back of my mind, I was thinking there is justice in this world.
And then you said, I wouldn't think I would ever see you again.
Yes. That's what I said. I never thought I was. And she was like, no, I just came here to apologize and say I'm sorry and all of these things.
Yes.
And I'm like, oh, okay, that sounds great. I said, I appreciate you apologizing. I didn't say it was okay because it's not okay. Didn't ever say that. I told her it's not okay, but I said, I appreciate you making the effort and coming and seeing me. And then she's talking about how she feels bad and life is bad and all of this, right? And she's probably listening to this podcast. It is what it is now. So anyway, and then she says, oh, my new job I'm at now, they laid me off too. I'm like, oh, cool. Okay, I understand. And she's like, oh, I saw you had a job ad on Indeed. And then I just said, stop, nice person. I know the real reason you're here. And she's like, what do you mean? I said, you know why you're really here. You're not here to apologize or say anything. She's like, what do you mean? I'm like, you're here because I have a job on Indeed and I'm paying more than anybody else for this job. And no one else is going to pay you as much as I would. That's why you're here. Speechless. Became bright red like a cherry. Like Patrick's ears when he gets upset. Patrick's our anesthesiologist. He's a great guy. Anesthesia provider. He gets very bright red when he's upset. And
when patients lie to him.
Yes. Oh, he gets very upset. But then I have to hear about it. But anyway, so, and then she just looks at me, doesn't say anything. I'm like, we both know the real reason you are here is because you think I'm going to hire you back and give you more money. You didn't come to apologize 3 years after the fact. You could have just sent me an email. You have my cell phone number. Yeah, I texted you 1,000,000 times. You have that number. You could have just texted me.
That you never responded to.
Exactly. And then, then, she didn't say anything. We had a cordial goodbye and she left. It was almost a surreal experience because I never thought I would see this person again. And this person, we had helped this person out a lot, So I was just shocked how life came back. I'm not happy she had trouble. I feel bad for her, but it makes you realize, I really believe in this. I think there is I believe in God, obviously, but I think there's a higher power that looks after all of us. And I think sometimes we can have a lot of blessings. I'm not saying bad things are wished upon us, but sometimes those blessings may not exist if, we don't do good for others. It doesn't always work out that way, but in this situation, I was like, wow, it did.
Yeah, I was shocked. I mean,
what did you feel about it?
I just, sometimes you hear about people, that have moved on and stuff, and you hear, chatter or gossip about things. But this was a very unique experience because that individual came back 3 years later to say how hell her life had become and, how she felt. She's literally said that. She said, every single day after I did that, I remembered that I did you guys wrong. And that every moment after that was literally karma coming back to me because I basically screwed you guys over. And it was really shocking to kind of hear, directly from that person who did it. Because a lot of times you hear about it and then you're like, it is what it is. And then you don't ever hear about that person again.
Mm-hmm.
But her coming back and saying that, I think was crazy.
Yeah, that was wild. That's something I'm never going to forget.
Yeah.
So John, I know you do a lot of interviews too, right? And you have had some experiences with interviews too, right?
Yes.
So what's the most unusual thing you've seen?
I've had all sorts of interviews. I mean, I've interviewed for many different positions for the company.
Sabrina has been hiring since she came to this company.
Yeah.
Literally.
I mean, our company's been growing, I would say, since I've been here,
Mm-hmm.
and, we're really blessed and thankful for everyone that's part of this, growth. And we were interviewed for many, many different positions, all the way from top to down, I would say. So it really surprises me when people don't understand, or maybe they don't know, which is really shocking in 2020, how to dress for interviews.
What do you mean?
Like I've had people come to interviews in crop tops.
No.
I've had people.
What kind of position?
All sorts of positions: front desk, RN,
in a crop top,
bookkeeper.
Yeah, a crop top is a top that ends above the belly button, right?
Correct. Like your whole abdomen is basically showing.
So did they have like a sweater on top so you can?
No, nothing. Low-waisted pants.
Free belly hanging in the air.
Yep. Low-waisted pants. No, there was not even a six pack that they were trying to show off.
What about a piercing?
Oh, it was literally literally the entire abdomen was showing with a low-waisted pant. They didn't even wear a high-waisted pant. They weren't even trying,
Seattle.
I'll say I've never seen that in the East Coast, so it must be a Seattle thing.
I think so.
The funniest thing was I remember when that person came and they checked and everything, and two of our the leadership staff literally turned around as I was going in the door. They're like, "That's the interviewee? Was that a patient?" I said, "She's here for an interview."
That's wild.
They were shocked. Flip-flops, literally flip-flops.
For an interview?
For an interview.
Like the single toe flip-flop?
Yes, the ones you wear to the bathroom.
Oh my God.
Yes, literally flip-flops. What else? Without a mask, like totally denying wearing a mask. Like
they're coming to a healthcare organization with no mask.
Correct. And I'm like, you need to put a mask on. Oh, I don't have one. Oh, well, unfortunately, I can't interview you.
Wow.
Literally, it's wild. Just like very casual attire, ripped jeans, destroyed jeans, ripped all the way up to their ASS.
Yeah.
Like, all sorts
Barak.
of yeah.
Yes.
And what else? Like coming late to the interview. I
I
mean,
remember that one person you guys sent away, and then she sent because she was late, and then she sent a long letter giving some kind of fraudulent explanation.
yeah. I mean, I understand things happen and all of that, but I mean, you can't come late to an interview. You'd rather just say that I couldn't make it, instead of coming like 30, 40 minutes late. I mean,
I think her reason was she was lost.
Yeah.
I mean, come on, you got Google Maps or whatever, get a Garmin for God's sake.
Yeah, I mean, a lot, and I sometimes ask the staff that we currently have, and I'm like, so would you ever come to an interview late? And they were like, no. A lot of our staff were like, we came the night before to kind of make sure where we were, going and kind of, scope out the area to make sure that we would come on time. Others was like, yeah, I came 30 minutes early and I waited in the parking lot, or came 10 minutes early and make sure I knew where the office was and everything. I mean, if you want the job, you're going to make the effort to come on time. Yeah.
And if you're not going to come on time for your interview, how are you going to be on time to check my patients in for surgery?
Exactly. This is a critical role.
Yeah.
It's, you're a provider, like an RN or, whatever else is critical, part of the, patient care. And we understand things happen and, emergencies do happen. But I mean, you got to be on time.
Can't be late, guys.
Yeah. I mean, it is what it is. You got to be on time.
So what's this other story I hear about a patient complaining that you all injected poison in their forehead?
Yeah. So this patient came in and saw one of our providers.
It was Gina, right?
Yeah.
Gina has the most unique patients.
Yeah.
I don't know why, but the patients who are the most eccentric, we love our patients. We don't use the C word unless you're the Fucci friend. But anyway, she gets the most eccentric patients with the most unusual demands and sort of follow-up care.
Yes. So she came, this person came in, and Gina saw them, they were getting Dysport. Dysport is a neuromodulator. It's like Botox. To keep it simple, I'll just say Botox. So this patient was coming in to get, Botox, and she did the treatment. Patient went home. Patient calls back, calls the office like a day later and says that they're having all these symptoms. And they're like, feel that there's poison in their head.
Poison?
Yeah, literally says the word poison.
How did they know there's poison?
They said that they're feeling all these weird things. They're feeling depressed all of a sudden. And they feel like they're going to faint. And they've lost their appetite.
How many days after was this?
A day after.
Oh my God. It doesn't even kick in for like 3 days.
Yeah. And that they're almost sure that this provider injected poison in their head and they don't know what to do with themselves and that they're going to go to the ER.
The ER for Botox.
Yes.
For forehead Botox.
Yes.
Guys, forehead Botox is like a little nothing procedure.
Yes. They're going to go to the ER because they're feeling all these things and they literally think there's poison in their head. And so, we're like, okay, send us pictures.
So before they said poison, did they just say, hey, I'm having these symptoms. Can you help me? That's a normal thing to do. People can have weird reactions.
Yeah.
Did they do that?
No.
So this person went straight to poison.
Yes.
Straight.
Yeah.
From 0 to poison.
Yes.
Or 0 to 100.
Yeah.
Wow.
Yes. Literally poison in my head.
Because sometimes you'll get this and that's okay. If you're having weird symptoms or something, we do talk to us, call us, we'll help you.
Mm-hmm.
But accusing us of putting poison, that's another.
Yeah.
That's a special person.
Yeah.
That's a do not schedule person.
DNS list.
Yeah.
So we're like, send pictures in. Do you see anything? No, I don't see anything. I just feel all these things and all this stuff, right? So what we said, okay, fine. We'll schedule you to come in to see an MD. We want to evaluate you, make sure you're doing well. So the patient eventually schedules an appointment with an MD. The MD then just, looks at them. Everything looks normal. I think they wanted more symmetric eyebrows or something like that. So they put a few drops.
So you guys put more poison in?
The person said that they had asymmetry and they weren't mentioning poison at that time when they came in. I don't know what it was.
Sounds like somebody wanted free extra units.
Maybe. And then, so they do that treatment and, we made sure there were two people in the room at that time with an MD to make sure that, we're all on the same page and we're not making up anything here.
When you got that consent, I would have put poison in the heading. Botox / poison.
And And then this patient calls back and says the MD put more poison in my head.
That's unbelievable. You know what I would have said? I'm just thinking about it now. I would have told him, well, botulinum toxin is a poison. So you are correct. How may I help you? You know?
Yeah.
What questions do you have?
Literally, they said that you guys put more poison in my head.
Well, it's true. You got poison. What you asked, you paid for it, and you signed off on it.
Oh my goodness. It was just, and then eventually they kept calling and they said they're going to the ER. And then they would say, well, if you feel that you need to go to the ER, then you should go to the ER.
Oh, that'd be a joke. They would kick that person out of the ER so quick. They would send him to the psych ward.
So yeah, they feel, I'm guessing they feel better because they stopped calling, or maybe they went to the ER. I don't know.
Wow. We love our patients. Weird things happen. We deal with it. Call us, please.
You need to put poison in your head.
No one's putting poison. And technically, okay, botulinum toxin could be considered a poison, but you're paying for it. You're asking for it. We love all our patients, guys, but we got to be reasonable. Thank you for listening to Clinic Talk on the Plastic Surgeon Podcast. Please rate and review us on Apple Podcasts to support the channel.
Tune in next time for more Clinic Talk. We have more great stories coming your way.
For my live surgeries on Snapchat and adventures throughout the week, catch us on all social media at realdrseattle.
See you next time. Bye.
Damn what?